and today is 4th of July 2016. पहला सवाल मोनिका, एज 31 from Mumbai. Your question that you have sent a DAM form for thyroid and lungs fibrosis. Monica, I am having your DAM form with me in my hand, and you have to do it in 3 steps. Step 1, you follow the standard diet which is given in this page. Standard diet for diabetes is same as standard diet for thyroid. Step 2, stop consuming milk and milk product totally. All refined food you must have to stop consuming. All packed food also you should not consume, including biscuit, bread, etc. That is the step 2. And step 3, continue this diet for 1 week, and by the end of 1 week, if you are able to lose about 1 kg, at least 1 kg of weight, then you have to reduce your medication Thyrox 50 by 50% and carry on with the diet for another 1 week, that is 15 days from now. And after 15 days, that is after reducing the medicine by 50%, you go for TSH test, and if your level of TSH is less than 6, need not to worry. This means there is a time to reduce the medicine totally, make it nil, make it 0, and continue for the 3rd week. And by the end of 3rd week, again go for a TSH test, and if still it is less than 6, this means you are free of medication. But carry on with this diet, and it will help you to reduce your weight, which is required about 5 to 6 kg weight you must reduce, and it will take care that you are healthy again. The question, second question, it is from Isha Peria, 5 years and virtual tour patient. Okay, you are following the diet, and your weight has reduced tremendously. It was 30 kg, but now it is 15 kg. Yeah, okay, it is really worrisome. Here I've gone through your complete question, Isha, and my answer to your question is you have to retain the weight. It is dangerous to lose this much of weight. This means either of the two things. One is that you are not eating as much as you should eat. So second thing I would say that you must add the following thing in your diet. Along with the diet which I have suggested, add grains, sprouted grains. It takes about 2 to 3 days to sprout the grains, and every day try to consume 50 grams in the whole day. Sprouts of 50 gram in the whole day if possible. Almonds of 50 gram in the whole day, not in one go. Right, little bit at various occasion, and totally 50 grams. And coconut, a raw coconut, the whole day 50 grams. So or try to consume all of this as much as you can, and try to eat more number of times. So it will take care that you gain a weight, reasonable weight, one, and second, you are able to maintain a good blood sugar level. Right now you are taking 2 units of insulin. At the time before joining our tour, you were taking 6 units of insulin. Yeah, the fourth thing which I told you, this will not only help you to gain weight and you will feel strong, and secondly, it will help you to maintain a good blood sugar. And I hope by continuing with this for some time, you will be able to free yourself of the insulin totally. And you have asked what to do in the school. You can take this in the school, right? And whenever you get some time, that is in short recess or long recess, or any other time of the, once one class is over and the other teacher has not yet come, you can take the time and eat little bit of any of the 4 which I told you. Along with that, always try to keep some fruits with you, and try to eat some fruits. It includes banana, it includes mango, it includes apple, or whatever you feel like to eat. Dhaval from Australia, and your age is 35, and your question is, for how long this initial diet plan is to be followed, and if possible please send the CD with all the detail and instruction of the camp. Dhaval, we have just uploaded our latest residential tour video, 2 hour and 15-minute video, in my YouTube channel, Dr Biswaroop Roy Chowdhury. So go to my YouTube channel and you can enjoy all the latest videos. Kanta, 53 years, Nagpur. Okay, Kanta, you've written your schedule. You have been taking the diet as I have recommended, and your question is that you morning you feel weak, right, and you don't want to go for yoga or walking, right, and in dinner your post meal is 230 to 250 blood sugar, and the morning blood sugar level is now 105. My suggestion to you is that before going to bed, eat 2 bananas, right? And it will take care that when you get up in the morning, you feel really fresh. Hamza, 4 years from Bangalore. We heard your last answer. You mentioned at one point that you can have one non-veg once a week. Is it applicable for diabetes type 1 patient also? Since we have Eid coming forward, we can give Hamza chicken for a day. Also wanted to know what is the cure for knee pain or joint pain. Okay, so first question, the answer of first question is uh, once a week is okay, uh, but anytime when you are consuming, when Hamza is consuming non-vegetarian food, before that it is good that if he could consume about 200 grams of raw vegetable, 200 grams raw vegetable first, and then take the non-vegetarian food, so that the ill effect of non-vegetarian food is reduced tremendously. And the question is knee pain and joint pain, the same diet which is there in this page, the diet for the standard diet. Along with that, add aloe vera, fresh aloe vera. Keep a plant with you. Take the early in the morning 4 spoon of aloe vera extracted from the plant leaves, and then take that same gel and apply on the knee and have a little massage for 10 to 15 minutes, and do it for 1 month, and you will get a great relief from knee pain or joint pain because of two reasons. One, it will help you to heal from within, and second, in most of the people, they get relief if they are able to lose 10% of the body weight. So both of this will together help a person to be free of the joint pain. Komal's daughter 24 years, Ulhas Nagar. Komal's other daughter 19 years. Diet for reduction of weight reduction. Yeah, I strongly suggest that you can go in this page, you can follow the diet given, the standard diet, and that will help a person to reduce about 10% of the weight in the first month, and the second month about 7% of the body weight, and third month if needed about 5% of the body weight. And once they achieve a right BMI, uh, so body mass index, then the weight will stabilize. Pradeep, should I follow the initial diet plan until 3 months, and is there any other instruction? Pradeep, it depends person to person, it depends patient to patient, but yes, for 3 months safely you can follow this diet. Suparna, 52 years. After getting the treatment done, returned from hospital recently with the problem remaining is that my blood sugar fluctuates between 600 to 40 mg per deciliter. Yeah, it is really dangerous, dangerously low and dangerously high. So here Suparna is suggests that you must start with the my DIP diet, the kind of diet which I recommend, and that is there in this page. Go through the diet and start following, and it will help you to maintain a good blood sugar. Kalol Bose, 54 years in Kolkata. Now I've been watching that in the morning the fasting is 1:30, after 11 I take dinner at 11:30, but gradually at around 1:30 or 2 p.m. my random shows 1:10, and then I feel hungry. I have back pain and with degeneration changes, okay, and have a stiff neck. Uh, Here, Kalol, the only suggestion I can give you is try to stick to the diet as much as possible, the kind of diet which I suggest. And secondly, need not to worry about the blood sugar much, need not to check the blood sugar too much. Too much of diagnosis is also bad. Only once a day, if you check, that too after eating food, wait for 2 hours and then check the blood sugar. If it is coming less than 250, need not to worry about anything, right? Don't worry about fasting. Fasting may not be the correct diagnosis. For more detail, you must watch my latest video, that is last days of diabetes. You go to my YouTube channel and watch my latest video, last days of diabetes, and there you'll find the scientific answer to your question. Onas, your question is 21-year VT patient, no insulin, sugar below 110 always. Can I have a drink which you have suggested while in virtual tour in lunch and dinner? Can I use soya bean? Avoid soya bean. Yes, you can have a Hunza drink, or the other kind of drink which I normally suggest in my virtual tour. Series, your question is, do you provide any medicine for diabetes cure? No, not at all. Rather, my job is to free you from medication, free you from drugs, free from diabetes and doctors as well. Okay, what are the other service provided? Please give the cost and brief detail. Also request you to provide your mobile number so that I can reach you personally for any further clarification. Shirish, my number is there in this page itself. You can find somewhere it is written, my mobile number. That is my office number, and through that you can reach me if you want. And secondly, I have authored some books. If you want, you can read those, or the best is you can go to my YouTube channel and watch my videos, and you'll get a lot of information which can be of use to you. Nandan, your question: want to attend the seminar for diabetes cure? Nandan, I have a seminar that is a train the trainer, that is Diabetes Educators Certified Diabetes Educators Summit on 17th of July 2016. That is on Sunday, starting at morning 8:30 till 2 p.m. It is a comprehensive training how you can take care of yourself, or how you can take care of your near and dear, helping them to recover from diabetes. Get more detail from my office, and you are most welcome to join that. Raj Prabha, your question is: kindly provide a specialized chart based on the enclosed DAM form and report. As I have very specific set of many disease, and due to the Tibetan herbal medicine, I am taking recommended to avoid apple, pomegranate, mango, milk and dry fruit. Okay. Raj Prabha, I am holding your DAM form in my hand. In fact, it is a list of um, diagnostic paper. It is a long list, and you not only the list of diagnosis is quite lengthy, the kind of the medication written is also quite lengthy. So here I suggest, number one, uh, start following the kind of diet which is already there in this page, right? Number two, avoid milk product and all kind of packed product. And here you have written Tibetan herbal medicine. I strongly recommend stop taking even that, and you have to choose one medicine system. Either you choose me or you choose them, because there may be some contradiction. But here my strong suggestion is stop taking the Tibetan herbal medicine, and here among the list of medicine you can safely stop all of them except the Thyronorm, which you can stop after 1 week of taking my diet, the recommended diet, which is already there in this page, right? Which include lot of fruits, like mango or pomegranate or apple, and where I suggest not to take any kind of milk or milk product, and not to take any animal food. If you do it for 1 week, and if you see that you are having a weight reduction of about 2 to 3% of your body weight, then safely next week you can stop taking Theranorm. But by the end of the week, the second week, try to check uh, your TSH level, and if it is within range means if it is below 6 or even below 7, then you are free of the drug, and strictly keep on following this diet, and quickly you will find that you are having more health, better health. All the best, Raj Prabha. Rishabh Agarwal, 13 years, diabetes type 1 patient, March VT, virtual tour patient, um, from Gurgaon. At that time you were taking 16 units of insulin, but now you are not taking any insulin. uh, Here your question is that would like to update that even though you brought back the diet, you are taking the diet, but your sugar level, the fasting is 200 and PP is 320 attached DAM form. I suggest you that here, for diabetes type 1 patient, it is the best uh, goal to manage the blood sugar is between 200 to 250. As long as it is less than 250, whether postprandial or fasting, everything is okay. But if it is going beyond 250, then there is a need to intervene with insulin. So keeping in mind your input, here I suggest that you can start with 2 units of lentils and carry on with the diet, and maybe within a week of following the diet, your blood sugar you'll be able to manage below 250 without that 2 unit, and that is what you can do. Convert Ghaziabad, your question: want to attend residential tour? Convert, my residential tour, the next tour is on in July. Uh, July, and that is 22, 23 and 24th of July. That is in Ho Chi Minh City, Vietnam. Uh, and as far as India is concerned, I think this year I don't have any residential tour, but virtual tour is 4th, 5th, and 6th August. So you can contact my office to be a part of it. Asif, VT patient, creatinine level 3.8 to 4.3, then it increased to 4.8, but now it is 6.6. And maybe yesterday you gave a call to my office and you are going to send me the latest creatinine level. Your blood pressure is 180 by 110 and your blood sugar is 320 to 350. Here, Asif, I've been closely following your records since you're my virtual tour patient, and uh, I must give a frank opinion that about 10% of the patient they don't get the desired result by following the diet and the kind of diet which I suggest. So that means those 10% of the patient must also have to take the intervention of the medication. This means always remember, Asif, that you should know you should have your blood pressure less than 150 by 90. But here in this case 180 by 110. This means you have to take some intervention, some medication for high blood pressure. Similarly, your blood sugar is 250 to 320 to 350. Again, it is on the higher side. It should be less than 250. Even if it is less than 300, it's okay. But still, it is more than. This means you have to take some lantus, about 2 to 3 units of lantus a day to maintain your sugar level below 300. Once you are able to achieve these two goals, that is blood pressure less than 150 by 90 and blood sugar near to 250, if you are able to maintain these two, slowly and gradually you will find that your creatinine level should come down. Normally with the diet it takes about 1 week for the creatinine level to go down, but in your case, as I see that 10% of patients they are not getting the expected result, so you may be among those 10%. This means you have to take the intervention of the medication for blood pressure and insulin for blood sugar, and also along with that keep following this diet strictly, and sooner I hope that you should get a better result. Kishore Kumar, your question, can you tell me the charges of 3 days of diabetes cure program at your center, also the address of your center? Right now, Kishore Kumar, this year we are not having any residential program in India. Now all the program are outside, but you can watch my latest YouTube video of the last residential tour in India, and through that you will get a lot of information which can help you to cure on your own by being at home without spending a penny. Abhijit, age 27. I am 27-year-old diabetic patient suffering from last 2 years, taking 30 to 40 units of insulin, daily working in night shift. Please advise what kind of diet will be less harmful to me as trying to find a new job. Uh, Abhijit, firstly, as I always tell to my patient that avoid any job which is having night shift. So second, during the night shift, keep a lot of fruits with you, and every 1 hour try to eat some kind of fruits. Also, if possible, add some coconut water, and throughout the night try to have 2 to 3 times the coconut water. Now there are some common question from Ajay, from Gurvinder's son, who is 7-year-old, from Dolly, who is 46 years of age, Amardeep Kaur, 52 years of age, Sujon, 32 years, Robert, 53 years, from South Africa, Rahul from Delhi, 30 years, and Angeline from Pakistan, 53 years, Rehan Ali, also from Pakistan, 30 years. You all want the diabetes diet plan. So here step 1, you see the diet plan in this page, you will find somewhere. Step 2, you watch my YouTube video, that is diabetes type 1 and type 2 cure in 72 hours. After following that YouTube video and seeing the diet plan which you can find in this page, you will be able to free yourself of diabetes. Very simple. Vrishali, that is clear, from Bangalore, send DAM form for thyroid. Okay, Vrishali, I am holding your DAM form in my hand, and mm, I could see that your lifestyle is quite well already. You're really following a good diet, except one thing, that you have to avoid taking milk product, right? So let me check your DAM form. It is there. Vishali, you are already following the good diet, so you have to keep following the same as you're doing it. That is one thing. And step 2, now it's time to reduce your thyroid medication dose. If you don't do it, right, and still following this diet, then hypothyroid will get translated into hyperthyroid. So all the thyroid patients, please listen to me carefully. If you are on this kind of diet, the kind of diet which I suggest, then it is your responsibility to taper down the thyroid medication. That is, after 1 week 50% reduction of the medication, and after 2 weeks 100% reduction of the medication. That is the thumb rule. If you don't do it, then you will be in a trap of another kind of disease, that is called hyperthyroid. But don't forget to check the TSH level. It should be below 6 or 7. Even if it is less than 10 and without the influence of the medication, need not to worry. Strictly follow the diet which the kind of diet which I suggest, and in your case, Vrishali, you are already doing so. Here the patient, while following this diet, they may expect to lose about 10% of the body weight. It is absolutely okay, need not to worry about that. But if you don't want to reduce weight, then add some grains, sprouted grains, about 50 grams to 100 grams of grains every day in your diet, and that will ensure that you do not lose much weight. In case those who are who want to remain little fat. Natasha, 50 years, from Delhi. Okay, you have written uh, your diet plan which you are following, and you are following a wonderful diet plan, and it is similar to what I suggest. And you, this is my daily routine for last 26 days, and my sugar level has come down from 250 to 240 to 250 fasting, from 400 to 370. 400 and 370. This means your fasting had been earlier 400, but now it has dropped to about 250. Good. I am still taking my medicine. Please advise me what else I can do to get my level down. Uh, One thing more, earlier my weight was 61, now it is 60, and you don't do any exercise. Okay. First thing, you must stop the medicine. Otherwise, it may lead to hypoglycemia, which is another difficult condition. Stop taking the medicine, carry on with the diet, and you're doing wonderful. Now, doctor, please, your second question, doctor. Uh, Please, doctor, do let me know. When I told my sister-in-law, she lives in US, about this diet, she also started following it. She was very overweight, but now she is losing weight and her sugar level is also getting down. Now she takes her medicine once a day. What else we should do to improve our health? Yes, she must also stop taking the medication. Right? She do not need any medication. The only thing is, after eating food, wait for 2 hours and then measure your blood sugar. And if it is less than 250, you have to worry about it. Stick to the diet and be happy. Muhammad Alauddin, 56, from Riyadh. Now, I have several disease, sugar, BP, arthritis. For this, I am using medicine for last 20 years. Please prescribe me the diet. Step 1, follow the diet which is there in the page, the standard diet for diabetes. The same diet will work for you. Step 2, as you follow the diet, keep a check on your blood pressure, that after a week's time measure the blood pressure. If it is less than 150 by 90, then you can consider stopping the blood pressure medication. But after discontinue the medication, wait for 3 days while following the diet, and again measure. If it is still less than 150 by 90, this means you don't need any blood pressure medication. Similarly, while being on this diet, you can safely stop the sugar medication totally, but every day after eating food, wait for 2 hours and then check the blood sugar. If it is, you are able to maintain below 250 or even below 300, then safely you can discontinue both the medication. And as far as arthritis is concerned, I strongly recommend not to take arthritis medication, because those are only symptomatic medicine. They can give a symptomatic relief but not a real cure. But while on this diet, within 3 months you will get rid of the arthritis as well. Gopal Singh, his daughter, 5 years. Okay, Amit. Need appointment as my disease is diabetes is 250. Wanted appointment to discuss diabetes. Gopal Singh, if your daughter is diabetes type 1, for diabetes type 1 for small children, we take the case on urgent basis, and I am leaving India on 6th of this month, that is day after tomorrow. This means tomorrow, if you can come, then you are most welcome. So tomorrow at 12 o'clock you can come to see me. So that is only for you. This appointment is for you, since you have a child who is 5 years old, and we are really concerned about the small children of diabetes type 1. So Satinder Dhiman, virtual tour patient, 50 years of age, from Delhi. Your initial fasting blood sugar was 217 and PP 327, but now it has reduced to 96 and 76 and PP 258, 240 and 320. Okay. Uh, Now, I want to draw your attention that 27th of May 2016 to 22nd 7th of June, I've been taking a lot of fruits and at least 800 grams to 1 kg vegetable, 300 gram to 500 gram. My weight was 71 kg before joining the camp. Now the weight is 62 kg. Is there any harm to me? Mostly eating nariyal pani. I take fruits and lunch time. I take vegetable, and evening I take tea with milk. Then dinner at around 8 to 8:30 I take vegetable only, about 400 to 500 grams. When I am committing where I am committing mistake now, I've started 3 unit. My humble request to kindly once again send the diet and quantity. uh, Satinder Dhiman, you are doing perfectly well. The only thing is add 20% more to the diet. This means if you are taking already 500 grams of vegetable, add 20% more. This means instead of taking 500 grams, maybe about 600 grams of vegetable, 800 grams, instead of that add 20% more. Whatever food you're taking, you're in the right direction, but add the quantity of the food. Add a lot of sprouts, add a lot of grains, sprouted grains, add a lot of nuts, that is soaked nuts. If you could do it right, then you will have a better health, stronger health. And also you may not require that 3 unit also. Initially, before joining my virtual tour, you were taking 30 units of insulin, but now you are taking 3 unit. While on the 3 days of the camp, you need not to take any unit of insulin. This means there is a scope that you can be free of insulin forever. The only thing is add 20% more to what you are eating. Suzanne, G's daughter, please send me any relevant information that I help my to reverse type 1 diabetes for my daughter. Okay, the best source is you can check my YouTube channel, Dr Biswaroop Roy Chowdhury, and there you'll find many relevant videos which can help you, which can guide you to help your daughter to be free from diabetes type 1. Ansuya, 40 years, from London. I am diabetic type 1 for past 2 years. I wanted to attend your workshop in August, but unfortunately I am having ailing mother uh, who is also blind and completely dependent on me. Uh, so can only attend in October. Need not to worry, we are having a virtual diabetes tour where you need not to leave your home. Rather, you have to be in your home for 3 days, 4th, 5th and 6th of August. So contact my office and you can participate in that while being at your home. Vasu, 13 years of age, from Delhi. I am suffering from sinus, due to which having acute headache and blocked nose. Or along with this, nasal bone is also deviated toward the left side. As a result, not able to breathe from the left nostril. Suggest me some cure. Vasu, simple. You have to add lot of vitamin C in your diet. How? Step 1, when you get up in the morning, you have to take about 100 ml of amla juice, fresh amla juice, freshly squeezed. Amla you'll get it with a lot of difficulty, but it is available if you ask your local vendor, local vegetable shop. If not, then you can replace with about 500 ml, half a liter of citrus juice, which may include mosmi juice, which may include pineapple juice, along with some pomegranate juice. If you could do it, along with that, you must avoid all animal food, including milk product. You must avoid all packed food, and add about 300 grams of raw vegetable, that is called salad, in your lunch and dinner, right? And let your breakfast be only fruit breakfast, about 500 grams of fruits, any fruits, seasonal fruit, maybe mango, since it is a mango season, right? Mango, banana, apple, or whatever or jamun, whatever you feel like. So do this, and you'll find that within 15 days of doing it, your headache will vanish, and you'll be more comfortable, and even you'll be able to breathe better. Sadi, 8 years old, from US. Thank you for prompt reply in the last virtual OPD. The one aspect we have found challenging is providing appropriate amount of a meal and snack portion based on her BMI. Okay, very simple solution, Sadi. Forget about the BMI. Only the rule of thumb, when you start eating breakfast, or when you start eating lunch, or when you start eating dinner, remember that you have to keep on eating till half an hour, at least half an hour. You have to keep on chewing at least for 30 minutes. If you could do it, that means your body has got enough food, right? At least it should not be less than 30 minutes. This means once you sit for your breakfast or lunch or dinner, you should not get up from the table before 30 minutes, and during the 30 minutes you have to keep on continuing with chewing, and that will ensure that appropriate amount of food has entered your body. Very simple. Saroja, your question, sent dam form for cancer of breast. Saroja, cancer can be cured with a special cancer diet, but first you have to decide that you have to stop taking any kind of other therapy, including chemotherapy and radiation. If you can do it, only then I can suggest you a diet for cancer. Question, Javed, क्या ब्लड कैंसर का डाइट प्लान से ठीक हो सकता है? Definitely yes. Many of my patients, they got recovered from blood cancer totally, and they are living a mm, healthy life, and you can read about them in my book called Why the Mortality Rate Drops When the Doctor Goes on Strike. Okay, Shiva, 42 years, your insulin initial fasting blood sugar 121 to 139, postprandial blood sugar 130 to 189. You are a virtual tour patient, right? Okay. You have some certain questions. I've been following your diet every day and even sometime no plate too. Still my fasting morning reading is 200, PP reading is around 250. I am taking Hunza tea 1 to 3 times a day, also tulsi leaves. Okay. Now your question is, I am not taking medicine, I am worried, please respond. Should change my diet. Okay. Uh, feel gastric, is it because of only veggies? Secondly, when I get up in the morning, don't feel energetic. Okay, this means the I suspect that you're taking lesser quantity of what I've suggested. Try to increase the quantity and then check that still whether you're feeling lethargic or now you're feeling energetic, and you feel gastric problem. My suspicion is that while eating you might not be chewing properly, so this time try to chew more and then see what happens, right? And then you're worried about blood sugar reading. According to me, you are maintaining a reasonable blood sugar, right? Healthy blood sugar. So but I suggest you that you read my book Last Days of Diabetes, which is also available in Hindi, and Diabetes Ke Antim Din, just released last month. Or you can better watch my video on the same topic, Last Days of Diabetes. There you will know that the kind of standard which I am maintaining is a healthy blood sugar range. Need not to worry. Uma, your question. I would like to invite you to Andhra Pradesh capital Vijayawada city. I am sure many would love to hear your reversing diabetes. Uma, sure, I would be loving to come to your city. And in fact, Andhra Pradesh is the state where I was born. So one more reason to be there. So contact my office and see you soon. Naina, I am interested to translate your article in Kannada language. Please suggest one article for Kannada. Okay, Naina, I will send you an article which you can translate and publish. Ajit's mother, 55 years, village. Okay, suffering from diabetes for 6 years. After seeing your diabetes video, YouTube channel started taking D1 D2C diet for 2 months, and then for the first month fasting was 81 or PP 132. At the end of second month fasting was 86 and PP 118. She already following D1 D2C diet with 3 months. Her problem is why I need to go to toilet urination many times a day, as well as night, due to which I'm not able to sleep properly. Sometimes it happens to the people who are following the diet and who are elderly. You need to worry about that. And the kind of diet which I suggest is also a very much watery kind of diet. It is having a lot of trap water. So many of my patients, they complain this, but it is a very normal thing. You need to worry, and slowly, gradually, within few months, you will find that your frequency will reduce. Manoj, your question is, from 8th of June 2016, I've started with general diet plan and followed 85%. So far, I would like to share my present health report. Okay, present health report. Manoj, I've gone through your report very carefully. Now, your question is, as per your early email on 6th of June 2016, I have stopped taking medication in the morning and all the medication. And today the fasting is 149 or 145 and the PP 145. Please guide me further. I request to please call me once if possible for you, or you arrange some seminar here in Jamnagar in near future. You are doing perfectly well. and you are having a healthy blood sugar range, so need not to worry. The only thing is stick to the kind of regime you are following. That's what I can say. And sometime definitely I would like to come to Jamnagar. Guru Sharanjit, 42 years, Faridabad. Presently having a blood sugar range 350 and PP 450. I am following the general diet plan since last 4 days. As I already reduced too much weight, and as I am on this diet further, I'll reduce my weight. But I want to gain weight. What should I do for this? And I also want to join your virtual tour so that I can be free of medication. Okay, my virtual tour is on 4th, 5th, and 6th of August, where you can join. And since you stay in Faridabad, I am having a diabetes summit on 17th of July in MCF Auditorium. I suggest you to join that as well, and stick to the diet, and slowly and gradually you'll find that you'll be more healthier. One, and secondly, if you are concerned about losing weight, then add grains, sprouted grains about 50 grams, add sprouts, mung sprout about 50 grams, add raw coconut about 50 grams, add nuts, almonds, soaked nuts about 50 grams. This means 200 grams of this every day along with the standard diet will ensure a good body weight as well. uh, Medamine Alwan from Algeria, 24 years, wanted to know what after 72 hours of diet, what should we eat then, what is the schedule after reversing diet. It depends from patient to patient, it depends from person to person. There is no rule of thumb, but my suggestion is for all of you that ensure that before 12 o'clock it should be only fruit diet, and always in lunch and dinner add about 400 grams of raw vegetable along with your standard meal. And beside that, in the evening at 5 o'clock, try to have some vegetable juice or try to have some nuts. If you are able to maintain this lifelong, I can assure you one thing, you will be free of lifestyle disease lifelong. Vasundhara from Maharashtra. After suggestion by one of your followers, benefited by your therapy, I started following your diet from 3rd June 2016. I stopped taking all the medicine. I take 600 grams of fruits from breakfast, including 2 mango, 2 banana, and other fruit. Now, because it increases sugar level, I have dropped mango and reduced the amount of banana from 2 to 1. For lunch, I take 400 grams of cucumber, tomato, carrot, and sometimes beet and 1 chapati. The same is repeated for the dinner. Sometimes no chapati and vegetable in the dinner. First 10 days fasting was around 168. Then I started increasing. Now the fasting is 240, and after food is crossing 300, 321, even 370. Blood pressure is okay. Only twice it was 140. Otherwise it was 124 or so. Should I continue with this diet? Should I take any? Should I make any change? Um, Vasundhara, you are doing fine, and here uh, your fasting is quite well. The only thing is PP is crossing 300. That is something which is little bit on the higher side, but need not to worry. Stick to the diet, and by following it for some more days, even your PP will also be stabilized. And only ask yourself how you're feeling. Is there any symptomatic discomfort? If that is so, then that can be a matter of concern. But it seems that you're feeling healthy. So once you're feeling healthy, need not to worry about anything. And mango is not a culprit, and even if it uh, shoots your blood sugar a little bit, it will come down on its own. So you can enjoy mango as much as you want, right? Jay Lakshmi, 39 years. I am 39-year-old and my second child is 2 months. For last from this my 6th month of pregnancy, I have diabetes and using insulin till now. Please tell me your meal plan, and I am feeding my baby. I follow the plan. Does it affect my feeding? Jayalakshmi, since you're feeding the baby, you must go for a very special diet plan. Step one, you every day you must have 7 different kind of drinks. Drink number one, early in the morning, about 2 glass, about 500 ml of citrus fruit juice, orange juice or mosmi juice or pineapple juice or pomegranate juice. 2 glass in the morning. When you drink it, it should be slowly. 1 glass in 10 minutes, another glass in 10 minutes. Then any time of the day, two times a day, 2 glass of coconut water, again 500 ml. Then in the evening, you must have 1 glass of vegetable juice, any vegetable juice, raw vegetable juice. And before sleep, about 1 glass of nut milk. How to make a nut milk? I'll ask my office to send you the procedure, or you can find the procedure to make the nut milk from this page only. It is there somewhere. Nut milk do not have milk, it only consists of nuts and water. and when you blend it in a mixie, it becomes milk. It looks like a milk, but it is a plant. It is from the plant milk. So nut milk about 2 glass, one in the night before going to sleep, and one any other time of the day. This means 7 glasses of drinks. Along with that, follow the standard diet plan which I normally give to my diabetes patient. Once you do this, you will find that within the first 2 days of following this diet, your blood sugar will come to normal and you need not to take the insulin, right? And second thing, you will quickly see that your child will have a better feed, and you will be able to produce more milk. Minu Jan, your question is, send a DAM form with the current diet and health detail after following the general diet plan for approximately 20 days. Want to know, can she discontinue or reduce the medicine? Minu Jain, your DAM form is in my hand now, and you are doing really wonderful. You are following the diet which I suggested very strictly, and I suggest you to follow it for some more days, right? So since it is giving you result, why you want to discontinue it? Bhupesh's mom, uh, yes, your question is that your mother, मेरी मम्मी को लास्ट 2 ईयर से कैंसर है, उनके ट्रीटमेंट एम से चल रहा है, 19 साइकिल ऑफ कीमो भी हो गया है था, लास्ट सितंबर को ट्रीटमेंट ख़त्म हो गया था, पर लास्ट मंथ माँ से फिर से उनके अंदर ये प्रॉब्लम क्रिएट हुआ है। फिर पहले बोन वीक हो गई, अब एक आई से दिखना बंद हो गया, डॉक्टर ने पेट स्कैन के लिए कहा था, एंड फिर बायोप्सी ली। स्टार्टिंग में जब हुआ था तो डॉक्टर ने सेकंड स्टेज बताया था, अब रिपोर्ट कहती है फोर्थ स्टेज, बता रहे हैं कि एडवांस हो गया है ये बीमारी। सर रियली मैं बहुत परेशान हूँ अपनी मम्मी को लेकर, मैं उन्हें खोना नहीं चाहता, प्लीज़ हेल्प मी। क्या कुछ हो सकता है? उनके फिर से कीमो स्टार्ट हुआ है 24 जून से। सर जो भी पॉसिबल हुआ वो मैं करूँगा, आप प्लीज़ इसका सलूशन ज़रूर देना, कैसे क्या हो सकता है। भूपेश, द फर्स्ट थिंग इज़, पहली बात मैं ये बताना चाहूँगा कि कैंसर का इलाज कीमोथेरेपी नहीं होता है, रेडियोथेरेपी नहीं होता है। वो इनिशियली ऐसा लगता है कि पेशेंट ठीक हो रहा है, लेकिन उसके बाद वो पेशेंट और ज़्यादा बीमार पड़ जाता है, जैसा आपने अपनी मम्मी के केस में देखा। पहले वो स्टेज 2 में थी, अब वो स्टेज 4 में है। सो यहाँ पे मैं आपको 2 बात बताऊँगा। पहली बात, यस, अगर आप कैंसर डाइट लेते हैं, एक स्पेसिफिक कैंसर डाइट, तो कैंसर पेशेंट जल्दी ठीक हो जाते हैं कुछ एक महीनों में। और उसके और डिटेल जानने के लिए आप मेरी बुक पढ़ सकते हैं, वाई द मोर्टेलिटी रेट ड्रॉप्स व्हेन द डॉक्टर्स गो ऑन स्ट्राइक। इसका चैप्टर 2 आप पढ़ेंगे तो आपको इस बात का पता और ज़्यादा गहराई से समझ आएगी। सेकेंडली, अगर आपकी मम्मी तैयार है सारे ट्रीटमेंट छोड़ने को, कीमोथेरेपी स्टॉप करने को, ओनली देन आई कैन सजेस्ट टू डाइट, बिकॉज जो डाइट मैं दूंगा वो बॉडी की इम्यूनिटी को बढ़ाएगा और कीमोथेरेपी बॉडी की इम्यूनिटी को घटाता है। सो कीमोथेरेपी के साथ ये डाइट नहीं चलने वाला है, तो दोनों आपस में ही झगड़ा करते रह जाएंगे, मेरी डाइट और वो कीमोथेरेपी। बिकॉज कीमोथेरेपी का प्रिंसिपल है कि इम्यूनिटी को बिल्कुल ज़ीरो कर दो और उससे पेशेंट को ठीक करने की कोशिश करो, जबकि हमारे डाइट का जो प्रिंसिपल है, इम्यूनिटी को इतना स्ट्रॉन्ग कर दो कि वो कैंसर सेल को खुद ही मार पाए। सो दोनों दो अपोजिट प्रिंसिपल पे काम करते हैं। सो जैसे मैंने बताया कि कीमोथेरेपी से कैंसर पेशेंट कभी ठीक नहीं हो सकते, सिर्फ टेम्पोरली एक रिलीफ मिलता है, ऐसा लगता है कि वो ठीक हो जाएंगे, लेकिन उसके बाद उस कीमोथेरेपी के असर की वजह से वो और ज़्यादा बीमार हो जाते हैं। इसको समझने के लिए आप मेरी एक और किताब है, हॉस्पिटल से ज़िंदा कैसे लौटें, इसको भी हो सके तो पढ़ें, या इसका पीडीएफ इसका पीडीएफ गूगल से आपको मिल जाएगा और ये फ्रीली अवेलेबल है। मेरी इस किताब को आप देखें तो आपको और जानकारी मिलेगी। सो मैं यही सजेस्ट करूँगा, स्टॉप ऑल काइंड ऑफ कीमोथेरेपी एंड रेडियोथेरेपी एंड देन आई कैन गिव यू अ कैंसर डाइट, एंड इफ शी स्ट्रिक्टली फॉलो इट, so I hope strongly that she will be recovered very quickly within few months. Sana Kausan Masi, 43 years, wanted to know that is the treatment by diet is possible for blood platelet around 32,000 to 1 lakh. Yes, the only thing is follow the kind of diet which is suggested in this page. One, second, add a lot of greens in every diet, right? So in the breakfast, try to eat 50% of the fruit which is green in color. In the lunch, 50% of the raw vegetable should be green in color. In the dinner, 50% of the raw vegetable should be green in color. And in evening 5 o'clock, add some green juice in your diet. If you can do it for 21 days, you'll find you'll have a healthy blood platelet. Sheila Chandak, your question. You're given a diet chart which you're following, and you're following a good diet chart, and you're given the blood report also, HbA1c 11.6, little on higher side, and kindly guide me how to maintain blood sugar around 250. My answer to you, uh, uh, I've I've carefully seen your diet chart. You're doing well. Only thing is, you stop taking the namkeen, stop taking anything which is refined, stop taking anything which is cooked in a oil. That is first. And second change I want you to make, at 7:30 every day you eat soup. Instead of soup, you start eating four kind of vegetable, raw vegetable, about 400 grams. And number three, try to add some soaked nuts in your diet, about 50 grams of nut. If you do this, I'm sure you'll be able to maintain your blood sugar around 250. Little Kumar from Odisha, send a dam form for cirrhosis. Little Kumar, I'm holding your dam form in my hand right now, and I could see that I could read uh, and find that you are having the feeling of nervousness, anxiety, and irritation along with cirrhosis. Here, I suggest you that um, you watch my YouTube channel, and there are some relevant videos which can help you to understand the cure for it. And step 2, on 14th of August 2016 in Mavalankar Auditorium at 12 noon, that is in Constitution Club, New Delhi, I am organizing a 2-hour seminar, and you must join that. If you cannot join it physically, you will get a link on this page only. You can join through YouTube, and through that you'll get more idea, more solution about your question. And now, Mrs. Mahajan's daughter. Thanks a lot for answering my query regarding diabetes of my 15-year-old daughter. Sir, as told about the pocket diet she is strictly following throughout the day, and 10 units of Lantus insulin is taken at 9 p.m. daily, and at 12 noon level usually is less than 100, but it increases after lunch. Before dinner sugar level is between 165 to 195, which really is considerable. Sir, before diagnosis of diabetes, her weight was 65 kg, but now at present she is 49 kg and seems so weak, which worries me a lot. Sir, after 5 days her school will be reopened. Kindly suggest the diet for school hours so that child doesn't feel hungry and weak. 6 hours of schooling. Sir, she is also taking few leaves of Nilkanti booty after meal, but if she skip, sugar level increases. Throw some light over it. Sir, kindly help my daughter to get rid of diabetes. Kindly answer my query as earliest as her school are opening. Yeah, you can send your child in the school with the following thing. First, any 2 to 3 kind of fruits which she can eat in the school. One is jamun, one is banana, one is apple, right? Without much hassle she can eat. uh, and send some kind of sprout, that is 50 gram of sprouts, moong ka sprout, and 50 gram of grains ka sprout, and 50 gram of coconut, and 50 gram of soaked almonds. So you pack this in the tiffin box and send her to school, and ask her that by the time she come back, the tiffin box should be empty, everything should be in the stomach. If she can do it, she will be able to help herself to free of diabetes and free of insulin as well. Madhuri Gupta, 53 years, you have given your complete um, medical report. You are recovering from your kidney problem. Yeah, and you're taking the diet, D1 D2C diet for last 4 days, and sugar level has come down uh, uh, about 60 mg uh, per liter, and fixed insulin dose. Madhuri, here my suggestion is, as your sugar level will drop, you must also taper down the insulin dose accordingly. Otherwise, you will land up in a hypoglycemic state, which is another big problem. So, as long as the sugar level is anywhere near or less than 300, everything is okay. So you can safely uh, reduce the insulin dose. You can even make it to zero. Sandhya Ghosh, year 32 years. Miss Sandhya Ghosh, age 32 years, 5 feet 8 inch, 73 kg, undergoing dialysis for last 5 years. 4 months, 5 years and 4 months, a juvenile diabetes patient taking 3 diabetes dialysis per week, having retinopathy, mild acidity, vomiting tendency, taking medicine for sugar, BP, and during dialysis injected again. Okay, consuming general Bengali food. Okay, please help me to have the detailed diet plan. Sandhya Ghosh, and the step one, you must start with the standard diabetes diet plan which is already there in this page. And once you start doing it, you have to quickly, within the first 2 days only, you have to taper down the dose for blood pressure medication, taper down the dose of sugar medication, taper down drastically. About 50% of the insulin must be reduced. Along with that, within the first week, the effect is will be expected effect will be so much good that instead of 3 dialysis per week, uh, it will be reduced to 2 dialysis per week. And if you keep on continuing this diet for about 1 month, the expected goal is that instead of 2 dialysis a week, now you'll be forced to go for only 1 dialysis a week. And slowly within 3 months, I hope that she will be free of dialysis, and she will be free of other associated problem as well. So start with this diet, but most important is you have to keep on tapering down the medication insulin, as this diet will play the role of medicine also. Vrishali's father, 73 years, HbA1c 6.71, fasting 93, pp is 126. Okay, BP control tablet taking. As he has a kidney problem, he cannot follow the diabetes diet. Please inform me the diet for kidney with diabetes and high BP. How to get cure from all these problems? Okay, here Vrishali, first let me correct. The diet for kidney is same as the diet for diabetes. Of course, here the doctors around you may confuse you, or may even tell that this diet will be harmful. So I always recommend to my patients that once you are on my diet, let it be secret. Don't tell your doctor, because I know, and I must tell you, the nutrition knowledge which the doctor is having is almost nil. It is almost similar to the nutrition knowledge which you have. They don't have more knowledge about nutrition than what you know about nutrition, because in their 7 years of medical study, the nutrition they have learned is about only 7 hours, right? So what they are saying, right, is just what they heard from here and there. So need not to depend on that, and strictly follow the diet which I told you, and quickly you'll see the result yourself as only. Okay, now Sanjay, 37 years, Odisha. Please inform me the diet for diabetes categorically with the same name, fruits and vegetable as well as timing. Yeah, here the important thing is seasonal fruits and seasonal vegetable. Any fruit and vegetable which is available in the season. How to know is it whether it is seasonal fruit or vegetable? If it is cheap, if it is readily available in the market, if it is available in abundance, then it is seasonal fruits and vegetable, right? So follow the standard diet given in this page, and always consider taking the seasonal fruits and vegetable. And now the season in India is mostly of mango, so enjoy the mango season, right? Kamran Nisa Sheikh from Mumbai. Hi, I want to join my mother-in-law for diabetes residential program, as she is on insulin. Please let me know wherever it is. Also, please, it is a request to conduct one such residential program here in Mumbai. Kamran, uh, I think that by the end of this year I will not have any other residential tour in India. However, in the last week of this month, I am having a residential tour in Vietnam. Probably it is on 22nd, 23rd, and 24th of July in Ho Chi Minh City. So you can consider uh, to join there. Anjali Malik's husband, 43 years, Faridabad. Personally, please sir, give me an appointment. I want to talk to you about my husband's health. He is a diabetic patient. He is also taking antidepressant tablet. Please give me an appointment. सर प्लीज़ हमें आपसे पर्सनली मिलना चाहते हैं. एक्चुअली माई हस्बैंड को दवाई से ज़्यादा काउंसलिंग की ज़रूरत है. Tomorrow at 12 you can come, right? I can give you only 5 minutes, because day after tomorrow I'm leaving for Vietnam, and again I'll come back after a week's time. So that's what I can do. Anjali, best of luck. Amar Kumar, your question is, what is the best replacement for wheat flour? Need to worry about replacement. When you take a lot of green vegetable, that too in raw form, you get all the necessary nutrient which is needed. You get the necessary protein, you get the necessary calcium, you get the necessary iron, you get the necessary vitamin D, everything you get in a better form. So, so need to worry about any replacement for wheat flour, right? With this, we come to the end of this virtual OPD. See you soon sometimes. All the best. Thank you.